In this video, we'll talk about systemic vascular anatomy and physiology. We'll talk about the anatomy of the blood vessels themselves, and then we'll talk a little bit about blood flow regulation. The vascular system is made up of the systemic vasculature and the pulmonary vasculature. Where does the systemic vasculature start and end? The systemic circulation starts at the aorta and is going to go through to the capillaries and end in the right atrium. So remember that we're taking oxygenated blood to the capillaries, and then we're taking deoxygenated blood back to the heart. Where does the pulmonary circulation start and end? The pulmonary circulation begins in the pulmonary trunk. That's going to go to the left and the right lung, and it's going to end back in the left atrium. Remember that we're taking deoxygenated blood to the pulmonary capillaries, and then we're taking oxygenated blood back to the heart. Let's zoom in on the arterial system. The arterial system is made up of, first and foremost, arteries. And arteries are our conductance vessels. These are strong, elastic vessels with 3 layers that have a lot within these 3 layers, but I'm going to draw your attention to just a few things. First, the endothelium, which lines the inner part of the vessel. And then we have a layer of smooth muscle that's going to help us vasoconstrict when we need it or vasodilate. And then we also have connective tissue. As you go further into the body, arteries are then going to split into arterioles. Arterioles are our resistance vessels. They're going to help distribute blood flow through the capillary system. So they're going to be really important when it comes to regulating blood pressure and blood flow. Let's talk about arterial blood flow. So how blood flow is actually moving through the body. Remember that our elastic fibers in the arterial wall allow for expansion and recoil. During systole, blood is going to be pushed forward through the heart, and that is going to increase pressure and flow in the arteries. This will cause the arteries to expand. During diastole, the aortic valve closes. At this point, there is less pressure in the arteries, and the arteries recoil. That recoil then continues to push blood forward. Arterioles then control more local blood flow. The force of venous return and this wave of contraction prevents backflow from the venous system. Now we can move into the capillary system. The capillary system is the microcirculation or the exchange vessels. That's where gas, nutrient, and waste exchange takes place. In the lungs, what is that called? It's called external respiration. This is where CO2 is leaving the bloodstream into the lungs where it can be exhaled and oxygen is coming into the bloodstream. Once I am at the tissues, what kind of respiration is that? That one is internal respiration. O2 is moving into the tissues, and CO2 and other metabolic waste is then moving into the bloodstream. And then finally, we'll talk about our venous system. These are our capacitance vessels. We have venules that are coming from the other side of the capillary bed, and they empty into the veins. The veins hold a large amount of blood with very little change in pressure. The one thing that is missing from this picture are valves, and those valves are there to prevent backflow. Really important thing to remember, because this is actually often a test question, is that 60% of the body's blood volume is in the venous system. Next, we're going to talk about systemic vascular resistance, because that'll be an important value as we talk about hemodynamics. So, systemic vascular resistance is really the opposing forces to blood flow through the systemic circulation. So, anytime that we're talking about resistance, we typically calculate it by looking at the change in pressure from the beginning to the end of the system in this case, and then we're going to divide it by flow. So, the equation is going to be our mean arterial pressure minus our right atrial pressure divided by our cardiac output. So MAP, really we want, if we're really starting, we're starting from the aortic pressure, but we're going to use blood pressure because that's what we really have to measure. We're going to look at right atrial pressure, which if we're looking at hemodynamic values, that is going to be CVP. And then cardiac output. How do I calculate mean arterial pressure? Just in case you've forgotten how to do that, that is diastolic pressure times 2 because we spend twice as much time in diastole as systole, and then divided by 3 because we're trying to find the average pressure. Okay, so let's do some practice. We have these values. And you'll notice I have blood pressure here rather than mean arterial pressure. So the first thing that we need to do is actually find mean arterial pressure. Remember that we're going to do 2 times diastolic plus our systolic pressure and then divide by 3. Make sure that you do this in the right order. So 80 times 2 equals plus 120 equals divided by 3 equals. That will give us 93. Then from there, we can find SVR. Remember, to find SVR, I need to start at the start of the system, which is mean arterial pressure of 93. And then we have to subtract out where we ended, which is right atrial pressure, which is the same thing as CVP. So that's going to be 4. So 93 minus 4. And then we're going to divide that answer by 6, our cardiac output. That's going to give us 14.8. Now, typically SVR is measured in dynes, but just pay attention if you are taking a test. Just look for the unit of measurement. If you see dynes, then you know that you need to multiply by 80 to get your final value. So if we take that 0.8 and times 80, we get 1200. Normal SVR is about 800 to 1200. Again, sometimes the range will be different depending on what reference or textbook you are using. A lot of times values can be slightly higher, slightly low without it really being significant. But if it's somewhere close to that 800 to 1200 range, then you should consider that patient to be normal. So let's talk about the different things that affect blood pressure. Blood volume, that means both intake and fluid loss. Cardiac output, which we're going to talk about more in another video, but that is made up of heart rate and stroke volume. And then systemic vascular resistance, which we just talked about. That's primarily controlled by the arteries and the arterioles. And then blood flow distribution between the arterial and the venous system. That's primarily controlled by the arterioles and the veins. Let's look at how vasoconstriction and dilation causes changes in blood pressure. So if we have vasoconstriction, then we'll have a decreased vascular space, but the volume is still the same. So if you're putting more volume in a smaller space, that's going to cause pressure to increase. On the flip side, if I have vasodilation, then suddenly I'll have an increased vascular space. But again, volume is the same. If I have more space but the same level of volume, then blood pressure will decrease. As we get into hemodynamics, it will be really important that you remember that mean arterial pressure should fall between 80 to 100. And that if mean arterial pressure falls significantly below 60, that results in decreased organ perfusion, particularly for the brain and kidneys, and that can quickly lead to organ failure. And a lot of times we associate that with shock. There's 4 different types of shock, and we will cover that more in detail later, but the ones that you need to be able to identify are cardiogenic, hypovolemic, obstructive, and distributive. Distributive is also called vasodilatory. A lot of times shock is characterized by hypotension and hypoperfusion. But I do want to point out that in response to a drop in blood pressure, Arteries will vasoconstrict, so there will be an increased SVR, at least initially. Vasodilatory shock is actually the only shock where decreased SVR is the defining characteristic or the cause. Controls the vascular system. There's several systems or mechanisms involved here. First, the autonomic nervous system, which controls heart rate and vascular tone. Then we have the renal system that's going to control fluid volume. And then the vascular system, which is going to have more local vascular control over blood flow. One of the ways that the autonomic nervous system controls the blood pressure is by the use of baroreceptors. Baroreceptors sense the change in pressure. They are located in the carotid sinuses and the aortic notch. These are going to sense the change in pressure and volume coming from the left ventricle. And then the arterial walls, the large thoracic and pulmonary veins, they also have baroreceptors, but they're particularly responsive to low volume changes. So let's kind of look at how baroreceptors work. If I were to have a loss of pressure, impulses are going to be sent to the cardioaccelerator center of the brain. That is going to increase sympathetic impulses, and then that will increase vasomotor impulses. Then that will cause vasoconstriction, and blood pressure will return to normal. On the flip side of that, when we have hypertension, it's not that it will stimulate the parasympathetic system in order to reduce blood pressure. Instead, as it sends signals to the brain, it will actually hit the cardio inhibitor part of the brain, and then that will decrease sympathetic impulses, decrease vasomotor impulses, and then that will decrease blood pressure. So, the last thing that we're going to talk about here is local blood flow control. So, we're talking about the arterioles here. Works by a couple of different mechanisms. The first is myogenic control. Here's the smooth muscle controls the vascular resistance in order to change the blood flow. This helps keep tissue perfusion constant. So, if there was an increase in blood pressure, for example, that would cause the vessels to stretch. Then that allows calcium to enter the cell, which will increase vascular resistance. If I increase vascular resistance, then I'll decrease the blood flow being able to go through that vessel. There's also a metabolic control. So the smooth muscle tone is going to react to local cellular metabolites. Some examples of vascular metabolites include CO2, which increases hydrogen ions, an increased temperature, increased lactic acid, also hydrogen, potassium, and then certain inflammatory chemicals like histamine, cytokines, and sometimes medications like adenosine. So let's look at how that works. So, for example, if I have a decrease in blood pressure, that means I have less blood flow going through the tissues. And when that happens, then I'm going to have a buildup of those metabolites because it's going to be built up in the tissue. With less blood flow, I don't have blood flow going to allow for that gas exchange, that nutrient exchange to take place. That's going to end up actually causing vasodilation. And that will allow an increase in blood flow through the tissue so that it can then get rid of those built up metabolites. Now let's just summarize our key points. The arterial system includes arteries that branch into arterioles. Arteries are conductance vessels, so changes in SVR can change blood pressure. If blood pressure or cardiac output decreases, SVR will increase to compensate. Arterioles are resistance vessels that control local blood flow in response to changes in blood pressure or blood flow or metabolic changes in the tissues. The venous system includes venules that then empty into veins. These vessels are capacitance vessels with valves that keep the blood flow from moving backwards. 60% of the body's blood volume is in the venous system. Capillaries are the exchange vessels where internal respiration occurs at tissue level and external respiration takes place in the lungs. SVR is equal to mean arterial pressure minus right atrial pressure, or CVP, divided by cardiac output. And normal is about 800 to 1200 dynes per second per centimeter to the fifth. Normal mean arterial pressure is 80 to 100, and it is critical if it is less than 60. Blood pressure is controlled by the autonomic nervous system, the renal system, and the vascular system. Baroreceptors detect changes in blood volume or pressure and send signals back to the brain to increase or decrease sympathetic signals.